Complex PTSD is not actually a diagnostic criteria in what we call the DSM, but it is often described as complicated PTSD, cumulative PTSD, where there's been multiple traumas, or prolonged trauma, or maybe just severe trauma. But I think it's very important to note that it's not its own diagnosis. Oftentimes I'll have someone come into the office and say, I want treatment for my complex PTSD. I want someone who specializes in complex PTSD. I want to empower you today to learn some of the basic first steps in organizing your complex PTSD. I'm Cristi Bundukamara. I'm a psychiatric nurse practitioner, but I have been through pretty significant trauma. I have lost 3 children over the course of 20 years and recently lost my husband. One of my sons went through 10 years of medical trauma. And so possibly you could call this severe or prolonged trauma in myself. I specifically teach on traumatic grief because obviously I've experienced grief of losing so many people that I love dearly, but every single one of them was a type of traumatic grief, was trauma. I have a grief intensive coming up. If you're interested in learning really how to treat and work through traumatic grief, click the link below. But today we are talking about complex PTSD. And oftentimes this diagnosis has kind of come up. Maybe we're talking about refractory. So refractory in the medical community means difficult to treat. Maybe you have gone to a counselor or a psychiatrist, you're on medication, you've done some treatment, and you are still having significant symptoms of PTSD. Make sure as you're doing that, as you're seeking that treatment, your provider has differentiated bipolar 2 from PTSD, and we have videos about bipolar 2 and how to diagnose that or how to recognize that. Because trauma and bipolar can look similar. They can coexist as well, but the treatment, if there's comorbid bipolar with that PTSD, is more of a mood stabilizer. So it just helps in the recovery and your healing if we have the right diagnoses. Oftentimes I feel like people say this complex PTSD because my doctor can't fix or I'm not improving after multiple treatment attempts. So just making sure that we're weeding out that what we call differential diagnosis. So complex PTSD means it's severe, it's prolonged, it has, maybe there's been multiple throughout your life. This is why it's super important when we talk about cognitive behavioral therapy, which is kind of a baseline treatment for depression, anxiety, and PTSD. Cognitive behavioral therapy is how you think impacts your mood and your choices, okay? And one of the pieces that we don't talk about enough in cognitive behavioral therapy is the organizational piece. I believe that you need to organize the different symptoms that you are experiencing because we treat them differently. We do something different about them. So we'll obviously start with trauma because we're talking about someone that has experienced a series of traumas in their life or a prolonged trauma. And what do we do with trauma? Well, we learn how to process and release it. Well, what if it's enmeshed with grief? We're not going to release the pain of losing our loved one. And so it's important that we separate that grief and trauma. And that's what my grief intensive is about. Remember, click on the link below if you want more information on separating grief and trauma. These things are processed differently. We use the word process all the time in therapy and counseling, But what we're really talking about is different with grief and trauma. When we are processing grief, we are feeling the pain of the loss, but we are cherishing that loss. 10 years from now, I will still be crying and a little sad on my children's birthdays or the anniversary of their death. Holidays are hard, right? The pain of grief can last forever. But when we enmesh it with trauma, we end up holding on to trauma. And the goal in trauma is to process and release. And so there's several ways to do that, but it has to do with movement. And I talk about that in the next video of like, how do you move these things out of your body? There's professional ways, EMDR, brain spotting, but just consciously in that organizational piece. Remember, you're dealing with this complex, what you feel like is complex PTSD. And I want to empower you to take this organizational piece. Instead of just showing up at the counselor or the psychiatrist, fix these symptoms. I want you to learn to organize them. So we talked about the trauma treatment, and you may need professional help there, what you do with grief. Let's talk about triggers. We talk about triggers a lot in PTSD, right? Like something triggers me and therefore I can't go to the store, or I can't do this, or 4th of July is really hard because of the fireworks. Or there's some situation that is hard because there's a trigger. Every triggers are external things that push an internal button. And that internal button likely has to do with your trauma, but it likely goes deeper into how that trauma changed how you think about yourself. It's more of a personal button. Let's use the fireworks as an example. The fireworks trigger a response. You've been to war, you've heard gunshots, and you have maybe lost somebody, right? And that triggers a PTSD response. That is triggering, yes, the trauma of war, but I want you to go deeper because there's likely a button underneath that. And when I say button, I mean like something internally very intimate and vulnerable. For example, it may be, I cannot protect my loved ones, right? Maybe you lost a dear friend in battle. Maybe you lost a limb, right? Those kinds of things go into grief. But when we're talking about triggers, what is the fear response underneath it? Not the physical response of, maybe going into fight or flight, but what is underneath that? What is your true core? I just keep calling it button. It's a very intimate thing inside of you. So when we talk about triggers, I want you to think deep rather than try to avoid. There's a type of therapy called systematic desensitization that actually continues to expose you to what triggers you so that you can desensitize yourself. But I take that a step further. If you could know what is underneath that, what is that core connection? Some people call it the inner child. What is that inner person afraid of? Or what do you feel like you didn't measure up to? One of my core connections is I'm not enough. I'm not good enough. No matter how hard I try, I'm not good enough. That's honestly a common core connection. So you will be able to, kind of control how you respond to those triggers, the more insight you have into what's underneath that. So now we have separated triggers, grief, trauma. You see how we treat them differently. Now let's go into negative self-talk. We often talk about trauma changes you, right? You become a different person. It is a new neural pathway in your brain. And oftentimes, especially if you're experiencing PTSD and complex PTSD, it's a negative change. It's a negative loop. Is it a negative thought? And I want you to stop and think about that for a minute. How are you talking to yourself? The things that you say to yourself, would you let your friend say to themselves? Would you say those things to your friend or someone that you cared about? Oftentimes, trauma changes the internal narrative. And this is something that you actually have a lot of control over, how you talk to yourself. And so that is why it's a separate category. Again, you have this complex PTSD. Let's get things into categories so that we can make a choice that is bite-sized. So let's say you're going to start just on your own, evaluating when you're triggered. You're going to start or stop talking negatively to yourself. And oftentimes I'll give this on a continuum of 0 to 10. And so if I have a negative thought that I'm not smart, I would ask myself, how much do I actually believe that on a 0 to 10? And hopefully it's a 9 or below, and you can start to feed into some positive. So many times some people will tell me, yeah, but my negative thoughts are true. I challenge that thought. Please try to reframe them. Try to say something positive about yourself that is real, because just walking around going, I am smart, may not help. But I could say to myself, you know what? I'm actually very emotionally intelligent. I am good at strategizing. I can see big pictures and I can orchestrate things, right? Like, focus on a positive that is the opposite of the negative, but that you really believe. So you see how we're organizing these things and doing different things about it. Behaviors and choices. Where is there some personal accountability? Let's say you are being triggered when you go outside of your house, and so therefore you have chosen not to go out anymore, and that is your choice, right? But is there a consequence to that choice? So what in your life is actually your personal responsibility that maybe you should be choosing something different? And this includes like addictions and things that maybe choices that are having a negative impact on you. I do not put addiction and choices in the same category because true addiction is complicated. There's a whole nother brain change that happens. So we put that also in a separate category. Injustices I put in a separate category as well, because these are triggers. They could be triggers for you, right? But you have very little control over them. They're big: racism, sexism, political things around you, where you live, how you grew up, right? Like, there are injustices in the world, and we put it in its own category because we have little control over it. And so we can't put a lot of energy there because we have so little control. But you can put energy there, but I want you to also focus on the other categories, because, for example, someone who has lost their child to a drunk driving accident may join the organization Mothers Against Drunk Driving, may speak publicly about their story and make an impact in that injustice. However, if they do it in anger and spite, and it's feeding the negative and feeding the trauma, they're not dealing with the other categories, right? So injustice is its own category because it's so external and we have so little power over it. Anxiety is something also that we put in another category because it is a spectrum. We can learn to self-regulate our anxiety, but don't tell yourself don't be anxious about anything, right? Like, there is so much more to anxiety. It's really more of a continuum. Can you bring the anxiety down to a manageable level? In complex PTSD, there's also comorbid panic anxiety, especially when triggered, right? So again, we're putting these things into separate categories so that we can learn how to process them. I have something called the Mentally Strong Method. You can learn that in our clinic with the psychoeducational counseling in the clinic. There are online courses for it. And of course, it is in our grief intensive that is specifically for traumatic grief. The last category I'm going to talk about is spiritual conflict. In our culture of kind of anti-religion, like, it's very personal, we often don't challenge people to explore their spiritual belief system and any conflicts that they have. And spiritual and mental health are often intertwined, especially in trauma. It's really hard to believe in a entity, a higher power that is good when you have experienced multiple traumas. And so spiritual conflict is there. It's to hold a space for you to explore that and explore your spiritual health. Whew. So complex PTSD starts with you. Healing from complex PTSD starts with you, and learning how to organize and putting these things into bite-sized pieces. All right, now for our questions. I actually diagnosed myself with complex PTSD because it's the only thing that describes my pain. PTSD seems hopeful, and there's lots of evidence that it can be treated, and I just don't think I can be treated. What a heavy question. And it's really more of a statement. It's a negative thought. It probably digs deep into a core connection where you actually believe that you're not good enough to heal. Maybe it's a spiritual conflict that you don't think you deserve to heal. The first step for you is not minimizing your pain. It's convincing yourself that you deserve and you can heal. I also want to take notice, if you are still in a traumatic situation, it is very hard to heal when you are still in trauma. I had that when my son was alive, and he was often sick, and we were afraid of him dying, and this 10 years of medical trauma, and it's really hard to heal. And I often see this in people with sexual trauma, and then they maybe get into a relationship where they are being traumatized. If you are currently being traumatized, find your safety person so that you can begin to come up with a safety plan. So 2 things, find safety and dig deep to believe that you deserve and can heal. The next question is, I know my PTSD is impacting my relationship, but I'm scared to go there. How do I start? That is a great question. And go on and watch some of my other videos. Go back and listen to this one about those different categories. It is often best to start with that positive self-talk, because if you can change that narrative, then you can get to a place of strength, right? It is okay to say in your life right now, I'm safe, I'm productive, I'm maybe raising my family, working, and I don't have time to open that trauma box. And that's okay, but don't never open it, okay? And work on the other categories. Work on the categories that are safer. Anxiety, what can you do to self-regulate your anxiety a little bit? Can you bring your anxiety down? Can you improve the way you talk to yourself? What are some behaviors and choices that maybe you are doing that's impacting your relationship that really have to do with your trauma? So instead of thinking of it as opening Pandora's box, think of it in categories. Think of it in small bite-sized pieces. What can I do to improve my behaviors and choices, my anxiety, my negative self-talk, right? And then one day when you're ready and you've strengthened those other categories, it's time to open that trauma box. All right, last question. How do I find a counselor who specializes in complex PTSD? I am all about empowering you on this journey. And if you show up to your counselor's office and you say, I'm learning about cognitive behavioral therapy, I'm learning about this mentally strong method thing, and we're putting stuff into categories, they can help you on things, techniques, treatments in those different categories. Yes, it would be great if all counselors were trained in complex PTSD, but they're not. And If you find one, through Google searches or Psychology Today, that's great. I can treat complex PTSD, and I don't advertise being a specialist in complex PTSD. And that is because I want to empower you. This organizational piece and putting it into bite-sized pieces, any counselor can help you manage that. Just tell them, I want to be in control of my treatment plan instead of showing up, dumping on them, and asking them for advice, right? Go in with a targeted plan. Look, I've got these categories, and I want to work on my trauma today, or I want to work on my negative self-talk. Is there things that you can help me with, right? So you come into that 50 minutes organized of what you want out of that. And you will get more out of it the more you show up with an intention and organization. I hope that helps. Continue watching, especially my video on post-traumatic growth. Let's begin growing from this horrible trauma that you've experienced.